A local student-led group is raising awareness about the use of hallucinogenic drugs in medicine. Students for Sensible Drug Policy Otepoti is staging a psychedelic potluck for residents to learn about associated local research. President James Parsons joins us to explain. Good evening.
Hello there.
What is the group's stance on the medicinal use of psychedelic drugs?
So our group's stance really as policy advocates is really to put forth the notion that there is a medicinal use of psychedelic drugs. Because we live in a society where these drugs are heavily prohibited, they're incredibly illegal, a lot of what we hear is about how they're bad, and there is another side to the coin, which is unfortunate that they're illegal because it means that our research institutions, like our universities, are actually unable to research these drugs because they're banned.
What drugs are we talking about?
So when we talk about psychedelics, we refer to some classical examples such as LSD, psilocybin mushrooms, mescaline cacti, and these compounds are found in nature but also can be synthesized in a laboratory. And what they do is they work on areas of our brain that are responsible for perception and cognition.
So how have they been used medicinally?
So when we are talking about a medicinal use of psychedelic drugs, that is something different from a recreational use. And what that involves generally is actually a lot of it's with a therapist team. So if you're dealing with a condition such as chronic addiction, you're working with someone who you've worked with for a long time, and you're in an environment with a lot of attention set out to the set and the setting to make sure that this is actually a therapeutic experience, not like a recreational. It's not for like parties. It's for having an experience which will allow people to view their conditions such as depression, addiction, or anxiety from a new perspective.
How will some of those drugs help those conditions?
Well, like I said, psychedelics are different from other drugs because they create new experiences where you can have a different way of looking at yourself in relation to your life. And that's incredibly valuable for therapists who are dealing with people who are really stuck in some conditions such as like trauma associated with instances of abuse or war, also chronic depression, like I said, addiction, and also even things such as anxiety related to knowing that the end of your life is coming if you have a terminal illness. Yeah.
Any local research being done on this?
So yes, there is actually local research, and Dunedin's in a really incredible position. It's attracting international spotlight because of research happening with certain psychedelics in the area of chronic addiction and also chronic depression and anxiety. This is all happening in places like Waikari Hospital, for example.
Now, the group that you are president of is organising a potluck.
Yeah.
How's that going to work?
So what it is basically a public forum where we're having local clinicians and professionals who are doing psychedelic research in Dunedin come and showcase their work. Because what we found is that not a lot of people actually know about the things that are happening in Dunedin, and there's a lot of interested people who would like to come and not only share their experiences but learn from people who are involved in the field and have some professional expertise in the area.
Who do you expect to attend?
Well, we're hoping people in the mental health field, but also students, people who are studying psychology, but also drug policy, and anyone who has an interest in this area. And we also encourage people who have had firsthand experiences with psychedelic drugs to come and share their experiences, because this is a unique forum for people to come and discuss these substances in an environment that's supportive and also non-judgmental.
Are you raising money at this potluck as well?
Yeah, so we're asking for donation. We're also asking people to bring a plate as well. But all the proceeds go to a US-based nonprofit. They're known as the Multidisciplinary Association for Psychedelic Studies, also known as MAPS. And what they're doing is they're trying to raise money for the final phase of treating post-traumatic stress disorder in vets returning from Iraq. So they need money to complete these trials because all their funding comes from donations and family organizations.
How many people are involved in the group?
So right now there's between 10 and 20 people. We're hoping to grow. We've only been around for almost a year now. And what we found though is one of the difficult things in getting people to be vocal about this issue is the notion of stigma. So people who are interested are kind of afraid to actually talk about it with their peers because they're afraid of being judged. Yeah.
Students for Sensible Drug Policy Otepoti President James Parsons.
Thank you so much.
Good luck with the potluck.
Yeah.
Thanks for coming in.
Yeah.